Through the Center for Diversity and Community Engagement, we oversee all of the service learning and volunteer opportunities that happen throughout the college.
Growing up, I didn't have a lot of access to the services, so a lot of times I can see myself in the patients that I help.
And we intentionally work with individuals who are traditionally underserved.
I think equity and inclusion are very important. I think one of the misnomers that people have is that we treat everybody the same. We treat everybody equally. Well, there's really no way to treat everybody fairly without taking into considerations all of the things that make up that person. So that's when you start talking about equity, making sure they have what they need to be able to be successful.
Last year we did a couple different variations of service learning. So we went on the community, we did at a local elementary school, we helped with vision and hearing screenings. At another elementary school, we helped with lead testing.
I'm passionate about this because it just brings me so much joy to bring a smile, a good conversation.
And by focusing on the community and social determinants of health, we're really looking at what we call primary prevention, which is truly preventing disease, creating a healthier community, and doing it in the terms of equity, where we are providing resources that are unique to that individual's needs, to that population's needs, rather than doing the same for everyone and doing it after disease has already occurred.
Sometimes it's a matter of people seeing that you're present and that you're visible and that you're a part of their community, then that gives them the belief that there's a possibility for them to be a student here, an employee here. So when you're intentional about those things and you're out in the community, then people view you as a partner.
After hanging out with the community, I always sit in my car and just reflect upon the experience, which is one of the things that Methodist does a lot. They encourage us to reflect on our experiences. But the one thing that I appreciate is you can always show love. You can always show compassion. And I think at the end of the day, just letting them know that they are loved or that they are cared for has some sort of impact.